Hi, Alvin here, and you are watching episode 43 of the 3-Minute Health Tip. In this episode, I'm going to talk about vertigo. Now, if you've ever experienced vertigo, it's a very difficult thing to deal with because of the fact that the symptoms of vertigo have to do with the room spinning, or you're swaying, or you feel like you're going to lose your balance and fall. And actually, people with severe symptoms of vertigo can barely get out of bed, and there's no way they're able to get to work, drive, or pretty much function. Just going to the bathroom is difficult, where you've got people are holding on to walls just so they don't fall over. And so vertigo is a real challenge in trying to help people that suffer from this, particularly when it becomes a chronic issue or something that seems to come and go for very many weeks or many months. Those of you that have been watching me over all of these videos now know that we're going to address vertigo from a different perspective than the conventional thought process, which has to do with a problem with the inner ear, maybe because of a fluid buildup or an infection. We're going to look at it from the new health perspective, this knowledge of G&M and the 5 biological laws, looking at the person suffering from vertigo as a biological unit comprised of the psyche, the brain, and the organ. And we know that these biological programs that create some of the symptoms that we experience, such as vertigo, all originate from an unexpected conflict shock that affects the brain, and it creates physiological changes, in this case, functional changes in the organ. And so the organ that's affected when we're dealing with vertigo are the inner ear. And the inner ear is controlled from the postsensory cortex of the brain. And the conflict that triggers this biological program, the unexpected conflict shock, is also known as a falling conflict. So vertigo comes about when we have a falling conflict. Now, what does that mean? A falling conflict could be somebody that is almost slips and fall because of the nature of their work. If you work as a construction worker, you're on the roof, or perhaps you work on surfaces where you have to really have your balance and you're afraid of falling, or you almost fell, that could trigger a vertigo symptoms perhaps the next morning. Watching or seeing somebody fall, or hearing somebody fall. Now, this happens a lot when you get a phone call from a family member who fell and broke their hip. That could lead to a vertigo symptom for you. Patients I've also seen suffered their vertigo symptoms after watching somebody collapse from a stroke or a heart attack in the swimming pool. That shock of seeing somebody fall the next morning creates their vertigo symptoms. Just like all of these biological programs, recognizing the conflict shock and identifying what it was for you if you were suffering from your vertigo symptoms is gonna go a long way in helping you sort of resolve those conflicts so you can get symptom relief. And so I've seen many cases of this. One particular woman had vertigo symptoms off and on for about 6 years. And when we talked about this, about a falling conflict, was there anybody that fell 6 years ago, somebody that you saw fall or heard fall, or maybe it was you afraid of falling? She mentioned that actually it was around the time that her daughter just started walking. And she remembers running around the corner, hearing her daughter at the top of the stairs, and then seeing her daughter fall down the entire flight of stairs, which was very traumatic. And it was after that she started getting these vertigo symptoms. And more recently, actually, my wife, who's also a chiropractor, was working in a clinic where while she was treating a patient, she heard a huge bang on the other room, and she ran out thinking it was a patient that fell off the table. But in fact, it was somebody that had knocked down one of the shelving units in that room. But everybody ran in there thinking it was somebody that fell off the table. Well, later on that day, on the way home, my wife was not able to drive because she suddenly started to experience severe vertigo symptoms. And I actually had to drive down to pick her up. And it was only after we figured it out and discussed it that she started to get relief shortly after that into the next day. I hope that those of you that are suffering from vertigo, which is very challenging, or those of you that treat people with vertigo, it's something that you want to start to look for. What was the falling conflict that they experienced, that they witnessed, or that they heard about somebody falling, and perhaps that their vertigo symptoms is tied to that conflict. And as always, that awareness is going to go a long way in helping you to finally get relief from your symptoms. So I hope that health tip was valuable. I want to thank you as always for your attention, and I'll see you at the next tip.